Just say again really loudly what happened.
Okay, I burned my foot very badly on my Foreman grill, and I now need someone to come and bring me into work.
How do you burn your foot on a George Foreman grill?
I enjoy having breakfast in bed. I like waking up to the smell of bacon. Sue me.
I don't really even recommend eating bacon because it's a processed meat which has a cancer risk. I mean, if you have it every now and then, it's not the end of the world. Do not cook it in bed while you're asleep with a hot... Ugh.
Today, I got up, I stepped onto the grill, and I clamped down on my foot.
Oh! That looks so fake, by the way. It would be burnt, it would be bloody, there would be skin peeling. That looks like he just, like a little cat scratch. I had the worst experience when I was a kid. My sister was using one of these pots. The pot actually you use to steam and like breathe over to help your sinuses. She asked me to bring it from the kitchen after it boiled, and as I'm bringing it, I spill it all over my crotch. Oh my God.
What's that?
What was that?
Oh! He hit the pole. It's broken, right? He can't.
Oh my gosh.
Oh, Dwight.
Oh! If you're throwing up immediately after a car accident, that's a potential sign for serious head trauma. You better be calling 911.
I am feeling better. My body's literally healing itself. It is amazing what the human body is capable of when you have a powerful brain.
I ground up 4 extra strength aspirin and put them in Michael's pudding. I do the same thing with my dog to get him to take his heartworm medicine.
Don't give people medicines that they're not ready for. Aspirin especially, it has all sorts of interactions with other medications. Some people are sensitive to aspirin. Like if I take an aspirin tablet, my nose bleeds because it actually impairs platelet function. If God forbid they have a procedure coming up, that would be detrimental. Children, if you give them aspirin, they can develop Reye syndrome. Please don't just dose people with aspirin just because you do the same thing with your dog. Bear's good at taking pills.
Oh. Okay, I think we need to take him to the hospital because
Oh no.
I'm pretty sure he has a concussion.
Oh, now you feel some compassion for him.
He needs to go right now, and you're his emergency contact. I think you should go with him.
Why don't you go with him?
I barely know him.
I want Michael to take me.
I can't take you. I don't have my car.
Why don't they just call 911?
Wake up.
Oh no, don't do
Let me
that.
help you, Dwight. Come
Okay,
on.
Pam.
Get up. Get up.
You're the best.
Yeah.
Keep him away.
Smells like chicken soup.
I know.
When you have a concussion, you need cognitive rest. Less lights, less sounds, less interaction, less movement. You need your brain to recover. And the worst concussion is actually your second concussion. God forbid you ever get a concussion in, let's say, a game. Do not go back into the game because the second concussion is going to be much worse.
What is more serious, a head injury or a foot injury?
A head injury.
Well,
So I'm ordering a CAT scan.
What is that?
The reason we get CT scans when someone's involved in a car accident, for example, is because if you have bleeding in the brain, it's an enclosed environment. The skull actually prevents blood from being able to displace the skin. And as a result, pressure builds up, and that could be really problematic outside of the fact that you're not getting enough circulation to the brain. We actually followed a specific set of guidelines known as the Canadian Head CT guidelines. You basically look at what the patient experienced, look at the type of trauma they had, what symptoms they're experiencing. You plug in the score, and it basically recommends whether or not you should have a CT scan. Remember that most CT scans expose you to as much radiation as between 100 and 1,000 X-rays. So if you don't need that excess radiation, you really shouldn't be getting it.
I'm having contractions, but they're irregular and far apart. So I'm not really in labor, I'm near labor.
Sometimes you can have false contractions when you get close. They're called Braxton Hicks contractions. Sometimes they're not sure. That's why they call our on-call answering service, and we give them some guidance.
Labor can last weeks. Then they take your insides out and they just plop them on a table, and sometimes epidurals don't work. You can poop yourself.
A lot of people poop during deliveries. I think I delivered like 30, maybe 40 babies during my residency training. And I would put the poop rate somewhere around 60, 70%. Safety of the baby and safety of the mother, most important, most important, most important, not the poop. Never thought I'd say that statement.
oh, hey, should I bring a dictionary to the hospital?
The hospital will provide dictionaries. Bring a thesaurus.
You need a dictionary or a thesaurus in a hospital.
This is ridiculous.
Dwight, get away.
No. Dwight, let Jim do that, please, okay?
I didn't know we had a tape measure.
We don't.
Was he gonna measure her cervix dilation with that? We do not put tape measures inside human bodies to measure anything. Again, another statement I never thought I would make.
Pam's doing great. She's 10 inches dilated now. Sorry, meters. Centimeters.
10 meters dilated. She's 30 feet dilated.
And she's also fully effaced, which I don't know what that is.
That means the babies
but no
are
baby
coming.
yet. It's only been 19 hours.
Halpert room D1. All right. family only beyond this point. Thank you.
It actually says patients and staff only. Normally we have a check-in desk where visitors have to check in and then we check to see if it's a good time for them to come in. We don't just let people barge in the midst of a delivery.
Babe, she's so beautiful.
Crying baby means a healthy baby. Why is he smoking a cigar?
Yeah. That's right. It's a baby, see?
Yeah, you shouldn't smoke in a hospital where there's oxygen tanks.
Ready? 1, 2, 3.
That's called the burrito technique. Very important to learn early on because it helps coddle the baby and helps him sleep.
Careful though, you don't want to break it.
She's not gonna just.
I got it.
Just the other day, I had first-time parents come in. They're nervous, and they're good nervous because they're excited. They want to do the right thing. They're asking a bunch of questions, but it's awesome because then the baby comes in for sometimes a newborn weight check, or sometimes they come in right away at the 2-month first visit for vaccinations, then 4 months and 6 months, and you get to see the baby grow. Like that, it's one of the most fun parts about being a doctor.
I can't tell if she's getting anything.
Really?
It doesn't feel right.
Well, you're pushing the milk out, right?
How would one do that?
Wasn't it? It's kind of like
No, you don't push milk out. The baby has to latch, and sometimes it's a process. The baby has a tongue tie, the breast anatomy. Sometimes it can be problematic, but it's all solvable. We have lactation specialists that meet with the moms. Perhaps they can do some supplementation, especially early on. It really depends on each individual case. But the general recommendation is to be breastfeeding your child.
Fire. Not real. This was merely a training exercise.
What?
So, what have we learned? Oh, come on. It's not real, Stanley. Don't have a heart attack.
No. Check for a pulse, call for help. If he's not pulsating and he's not breathing.
Chest compressions, chest compressions, chest compressions.
Andy?
A throne for your highness.
I'm not sitting in a wheelchair.
No debate. You are going to sit in that wheelchair.
You actually don't want to be sitting in a wheelchair when you don't want to. That could actually decondition your heart, your body. You want to be as active as possible to the safest degree. Why? Because you actually are training your heart, you're burning calories, you're keeping your metabolism up. All these things are really positive to decrease cardiac event risk, especially when you've already had a first heart attack.
ABC, okay? And that stands for airway,
breathing, and compressions.
circulation.
Okay.
I threw in the compressions just because I love the compressions. Because if there's no circulation, what do? I heard you say it.
I can't keep doing this forever.
It's been 20 seconds.
2 minutes.
Call it.
Call it. No, you do it until you realize that it is futile. Just to make it clear, I feel like this gets confused for most people when they watch these shows. If someone has a heart attack, it doesn't always mean that they need chest compressions. I've literally seen someone discuss this before, where they're like, oh my God, my family member's having a heart attack. Start chest compressions. No. Yes, heart attacks can sometimes lead to your heart stopping where you need chest compressions. Not all heart attacks need chest compressions. Person's awake and alert, they don't need chest compressions.
You're losing them.
Those are bad chest compressions, not deep enough, too fast. You want to do it to the tune of 100 beats per minute. There's a lot of famous songs that you could do it to. I like Staying Alive. I would sing it. I'm not trying to get demonetized.
Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
Check for an organ donor card. If he has one, we only have minutes to harvest.
He has no wallet, I checked.
He is an organ donor.
He is, yeah. Give me some ice in a styrofoam bucket.
Whoa!
Here we go.
Did he just whip out a knife?
I feel like a banana split.
Oh, did we tear a groin muscle? When office parties get buck wild. I also don't know, he could have injured his testicular area.
I was dancing and I did a split and I landed on my car keys in my pocket.
Oh, I did not expect that to be the diagnosis. What is the ICD-10 code for that? What do you think is a worse story? Crashed a car because of a tiny spider or tore scrotum while dancing? Don't know.
Am I interrupting? Oh no, Dr. Long, please come in. This is Ross. He is the father.
But not the husband, because evidently she can do this alone.
I really felt like I was Ross growing up. I was the geek, I was the nerd, and I've always loved Rachel.
There's your uterus, and right here is your baby.
Oh my God.
Always a really powerful moment when parents get to see the heartbeat of the baby. I would usually show the chambers and the heart beating. Family gets really excited. It's a special place to be when you're delivering a baby. Like, as a family medicine doctor, I no longer do it, even though I'm licensed and I know how. I've delivered 38 babies in residency.
Pretty amazing, huh?
I've seen Friends so many times. I know what she's crying about.
I don't see
Yes.
It's so funny, nowadays it would be less of an issue because we have like these 3D ultrasounds that can actually show the face of the baby. We can print out the pictures and then the parents go show them around to their families. It's really cute.
Hi, this is Rachel Green. I'm Ross Geller. We called from the car.
Right. We have a semi-private labor room waiting for you. So
Oh,
we're just gonna...
whoa. I'm sorry. Semi-private? We asked for a private room.
Yeah.
Yes, I see that here. Unfortunately, we can't guarantee a private room, and currently they're all unavailable.
Hospitals, especially in big cities like New York City, they run out of rooms quickly. So sometimes, especially when you first arrive, you can get only a semi-private room, and then like whoever has the most seniority, who's been at the hospital the longest, they may shift you around and move you to a private room.
Check these out.
It's a funny position for us. Back in the day, these used to be called stirrups. We tend not to use that word anymore because weird connotations. We now call them leg rests or ankle rests or foot rests.
What's that?
New people.
When it's your first pregnancy, statistically it takes longer. You have a longer labor. If someone's coming in for their third or fourth baby, usually the process is a lot quicker, so you're gonna have multiple roommates if it's your first.
You listen to me. Since I have been waiting, 4 women, that's 4, one higher than the number of centimeters that I am dilated, have come and gone with their babies. I'm next. It's my turn. It's only fair.
When she says she's 3 centimeters dilated, what she's talking about is the opening of the cervix. That's the opening of the uterus. The way we monitor the progression of labor is through doing an estimate measurement, usually through a digital exam using our fingers, to see what that dilation is. And 3 centimeters dilated is really early in the labor process.
Push. I'm gonna push for 5 more seconds.
My favorite part of this is the resident or medical student just standing there. That is so accurate. They just stand there aimlessly like, what should I do? I'm learning. That was me back in the day. That was all of us. One thing is, I don't know why the doctor's now wearing a mask. We wear masks.
Wait. I see something.
What, you do? You do? Oh my God!
Don't say, oh my God, what?
What is that?
It's the baby's buttocks. She's breech.
Oh my God, I thought she had 2 heads.
Breech means the baby is coming out not head first, coming out butt first, which is problematic. You want the baby to come down and descend the canal head first. Breech has a high rate of complications. It's gonna be a tricky delivery, especially if it's this far along, but I love that Ross took a look and did not faint. Because a lot of fathers, when they take a look, they're not ready to see everything that's going on. They get a vasovagal reaction where blood pressure drops, not enough circulation, not enough blood flow getting to the head, and they go wham! I always have my nurses keeping an eye on the dads while the mom's delivering.
You're gonna have to push even harder. Nothing's happening. I'm sorry, I can't.
Yes, you can. Hey, come on, you can. I know you can do this. Let's go.
I can't do it. Please, you do it for me.
No.
What they're missing here is the mom shouldn't just be pushing aimlessly. She should be doing it along with the contraction, so it should be timed. Like we get to see the baby monitor on the side. When we see the contraction starting, mom should feel it. And at that point, we should have the mom bear down, push, count, and maybe give a second effort there. But they're just, looks like they're pushing aimlessly. That is not a newborn baby.
Oh, she's perfect. Oh.
Oh, she's so tiny. Where'd she go?
So we always try and get the baby on the mom's chest as fast as possible. We feel like the best sort of effects happen when the baby gets right on the mom's chest. Mom calms down. It helps lower her blood pressure, slow the heart rate down. Baby feels mom. It's like nature at its finest. And while mom is holding the baby, then we let the father step in and cut the umbilical cord. Dads panic when they cut the umbilical cord because it's kind of rubbery and it takes a little bit of force and they don't want to hurt anything, so they're really worried about doing it. It's really cute to watch. And I love that. That's like one of my favorite parts, getting the dad involved to do something.
Hi, and you're going into what grade?
I'm actually a first-year resident, but I get that a lot. See, I graduated early.
Me too.
That's me every time in the hospital. What are you, 10? Are you in kindergarten? What grade are you in? Are you like Doogie Howser? Then occasionally someone would be like, wow, you're young. That means you must be smart. And I was like, thank you.
Mr. Tribbiani, I'm afraid you've got kidney stones.
Well, what else could it be?
It's kidney stones.
To diagnose kidney stones, sometimes we do an x-ray like that. Better tests, which we tend to do more often, would be a CT scan with very specific parameters. We could also get an ultrasound. All those are options.
Better, sweetie?
Maybe a little. Wish you hadn't seen me throw up.
Sometimes the pain can get so bad that it can lead you to vomit. I'm gonna give you a little revelation here. I've passed kidney stones before. When I was really young, didn't drink a lot of water, I drank a lot of soda, and I passed one of these stones, and they were tiny, tiny, tiny. But boy, did it hurt. There was blood. Oh my God. If you ever have to pass one, I'm sorry, because it's not a fun experience. So I sympathize with my patients, and I empathize with my man Joey here.
Now, ordinarily, Mr. Tribbiani, we try to break the stones up with shock waves, but they're too close to the bladder now. Which means we can either wait for you to pass them or else go up the urethra.
Whoa! No. Nothing is going up, okay? Up. Up is not an option. What's a urethra?
Actually, up is sometimes an option, and sometimes it's something we have to do to inspect the bladder. Another potential option for patients who are looking to pass stones is giving them a medication to help in that process, to relax the smooth muscles of that area.
Oh my God.
You did it, man.
Would you like to see them?
They're so small.
They're not that small. Those are fairly big size.
I was in the shower, and as I was cleansing myself, I felt something.
Was it like a sneeze, only better?
No, I mean like a thing on my body.
What was it?
Well, I don't know. It's kind of in a place that's not visually accessible to me, and I was hoping maybe you guys could help me out.
Whoa! That's funny because random people tend to approach me and show me their lesions quite often. I cannot imagine how dermatologists must feel.
That's not a third nipple. First of all, it's on your ass.
Doctors don't say that.
Jansen, will you come in here a moment?
I'm with Hamilton.
He's good with weird things. Bring him in, too.
It's funny because anytime you have a rare condition in a hospital, you're gonna get residents, specialists, fellows, everyone coming in, not only to help the case, but also to learn, because we learn from our patients as much as we help them.
You okay, Ross?
I don't know. What's in this pie?
I don't know, butter and eggs and flour and lime and kiwi and...
Kiwi? You said it was a key lime pie.
No, I didn't. I said kiwi lime. That's what makes it so special.
That's what's gonna kill me. I'm allergic to kiwi.
Russ is experiencing an anaphylactic attack. His upper airway is literally swelling. It's closing up. That can be quite dangerous quite quickly. He also has dilation of all of his blood vessels, which drops your blood pressure quite rapidly. Your heart rate usually springs up to compensate for this loss of pressure, but sometimes the blood pressure effects can lead you to faint, vomit, feel awful, have a headache, and you desperately need to get to a place that has an epinephrine auto-injector.
No, you're not. You're allergic to lobster and peanuts and...
This reminds me of the scene from Hitch.
Whoa. You right?
Oh, no, yeah.
Is your tongue swelling up?
Either that or my mouth is getting smaller.
Both?
All right, get your coat. We're gonna go to the hospital.
You really should call 911 in these situations because the ambulance will arrive usually with an epinephrine auto-injector on board, and they can administer it if they need to. The last thing you want is to get in a car and then the swelling gets worse and then your throat closes up in the car and you don't know what to do. So call 911 for help. Even if you actually give yourself an epinephrine auto-injector, you should still head to the ER. 20% of the time, you may need either a second injection or other interventions because the first one has failed. You also need to be monitored after you give yourself epinephrine, your heart rate, your blood pressure, all of that.
There's no way I'm gonna get a shot. I mean, maybe they can take the needle, and squirt it into my mouth. You're like a squirt gun.
You have to give the shot. You have to give it quickly, way quicker than what he's experiencing here. And you have to give it right in the anterior lateral portion of your thigh. That's where you can get the most absorption as fast as possible. Remember, this is an emergency.
Add a pinch of saffron, it makes all the difference.
This is partially the reason I really wanted to be a doctor. This scene, the admiration Monica and Rachel are giving my man George, and I forgot the other, John White? Noah Wiley. getting all this attention. I wanted it. Mostly because no one paid attention to me, not because I was like huge ego.
You're gonna walk over to the operating table, you're gonna stop on that blue mark, you're gonna put the tray down. Don't walk too fast. But don't dawdle.
Okay, now what?
If they're truly operating on this patient, why are all their masks down and why does Phoebe have no gloves on? I don't like what's happening here. I know this is a show inside of a show inside of a show, and we're in Inception land, but I still get frustrated because I want you to have an accurate picture of what happens in a hospital system. You dig? Don't know what I'm doing, but it feels like I'm squaring up the conversation.
How's it going?
Going really good. But enough about me. Come on. Where are you from? What do you do?
I'm a doctor.
Right. Right. I meant, you know, in your spare time. Do you cook? Do you ski? Or just hang out with your wife or girlfriend?
I don't have a wife or girlfriend, but I do like to ski.
Oh, I love to ski. How amazing is this?
This conversation legitimately happens. It happens more actually in the hospital setting. Patients are usually there overnight or for several days at a time. You get quite lonely, so they want to have a conversation. But when it starts crossing into that territory where they're trying to get into my personal life and see if I'm single, that's when it gets a little weird and boundaries need to be set.
So, are you experiencing any discomfort?
No, I'm very comfortable.
Oh my God, this reminds me of my interview that I just did on The Daily Show not too long ago.
How close is too close?
Ideally, you'd want to keep 6 feet away from anyone that you're not familiar with.
Would this be too close?
In my professional medical opinion, I would say that's too close. So 6 feet and washing your hands.
Is this too close?
That would be too close.
Too close.
Awkward.
Hello.
I slipped in the shower and I think I dislocated my shoulder.
Ow.
Not surprising. You have no safety mat or adhesive stickers to allow for purchase on a surface with a low coefficient of static friction.
Basically, she had no grip in the shower. I actually am a firm believer that you need to make your shower safe, whether that means putting grips on the side so you can hold on if in case you do slip, or maybe even better than and putting some textured floor, either tape or rug or mat or something that's secured down to the floor to prevent you from slipping.
Oh my God, I gotta go to the emergency room.
Well, assuming you're correct that your right humerus is no longer seated in the glenoid socket, I would certainly think so.
That's actually very accurate. That's what happens during shoulder dislocation. Your humerus, which is so funny that it's called that, actually gets dislocated out of the glenoid fossa, which is the shoulder joint in here, and it creates a lot of pain. That being said, to put it back in is very painful. Once it's in, unless you tore something, it feels fine. There's actually been videos of like UFC fighters dislocating their shoulder, getting it popped back in, and then continuing on with the match. And if you have an instance of dislocating your shoulder once, you have a higher rate of recurrence of it happening again because the ligaments and all the attachments to it start becoming lax, basically very stretchy. And as a result, they're not as secure and it can pop in and out.
Moving to psychiatric disorders, list all major behavioral diagnoses, e.g. depression, anxiety, etc.
Oh my God, what the hell does this have to do with my stupid shoulder?
It's important to know for doctors a complete picture. In order to be properly practicing, you need to use holistic care. In order to be holistic, you need to know the entire picture. Do you have any other medications on board? Do you have any other medical problems on board? Some medical problems can cause certain others to behave differently. Some medications cannot be used with other medications. If you're pregnant, we may be less likely to want to scan you. If you're pregnant, we might not be able to give you the same antibiotics, et cetera, et cetera.
You were given powerful pain medication and a muscle relaxers.
In a lot of these situations, we give a patient maybe mild to moderate sedation in the emergency room when we try to reduce the dislocated joint. Reduction of a joint literally means popping it back in place. I don't know why in medicine we always have to complicate everything. Just say pop it back in. Why reduction?
Wait! You have to help me get into bed.
Sheldon has to get me into bed.
Now, unless there was something broken, putting a patient in an arm cast like that for more than a day is not ideal because then you start really risking the development of adhesive capsulitis from lack of mobility. So you want to get that mobility going as quickly as possible, ideally working with the physical therapist to make sure that you're not going too far and harming the injury.
How's your family?
Oh, it was the worst trip. Everyone got sick over the weekend.
Sick? Here we go.
I don't know why people have a habit of this. When someone in their family gets sick, they spend all their time with them and then they come and hang out with others. Like, you know you're going to be the one spreading the illness.
Sheldon, relax. She doesn't have any symptoms. I'm sure she's not contagious.
That's not how it works. You're contagious usually, or at least up to 24 hours before you show symptoms.
Here, swab my throat.
I don't think so.
Leonard, if I'm going to get ahead of this thing, I need to find out what's growing in my throat.
You don't generally swab someone who's asymptomatic, meaning someone that's not showing symptoms, because that's not gonna give you a lot of useful information. You may be just colonized with a specific bacteria, but if it's not infecting you, meaning it's not creating symptoms, treating it may actually cause more harm than good.
I'm going back to bed.
Wait, put this in the bathroom.
What for?
I need to measure my fluid intake and output to make sure my kidneys aren't shutting down.
Why would your kidneys be shutting down? Like, you feel great. Why?
Why?
We actually do monitor patients 24 hours ins and outs in the hospital. Usually it's reserved for patients who have some sort of kidney issue, or they're having a diagnosis of heart failure and they're fluid overloaded.
I want soup.
Why didn't you just...
Send the person home.
Don't you imagine that if there were a way for me to have had soup at home, I would have thought of it?
You can have soup delivered.
I did not think of that. Clearly febrile delirium is setting in. Please bring me some soup while I still understand what a spoon is for.
Febrile delirium is something that happens when someone's temperature is so high that their brain is no longer able to function cognitively. But your temperature would need to be quite high for quite a long period of time, unless you're incredibly frail or of old age, which he is not.
My mother used to make me this split pea with little Frankfurter slices and these homemade croutons.
We have chicken, tortilla, and potato leek.
Could I get any of those with little Frankfurter slices and homemade croutons?
No.
Then surprise me.
You know, chicken noodle soup has actually worked as a viral upper respiratory infection remedy. It warms the throat, creates more circulation, gives you added electrolytes to help you better manage your fluid intake and output. Maybe grandma was right.
Okay, nice and cozy. Okay, I'll see you later.
Wait. Will you please rub this on my chest?
People love Vicks. They swear by Vicks. And the way Vicks works is you rub it onto your chest and it creates a cooling sensation because the menthol evaporates quite quickly, thereby cooling the superficial portion of the skin. It takes away some of the discomfort that you may be experiencing in your chest. And at the same time, if you have a fever, it can help cool your body down from that fever. That being said, I'm not always in favor of getting all fevers down because a fever is actually advantageous to your body in order to fight off said infection. There are instances where a fever can be problematic if it's incredibly high, you have other medical conditions, you're frail, etc. But for a young, healthy adult like Sheldon here, he'd probably be fine. Is this Sheldon?
You're the doctor, but I'm constantly hearing this annoying sound.
That could be tinnitus, where you hear, most people describe it as ringing in their ears, but other people call it a drum, a weird sound, and it could happen for a whole host of reasons. What I've been seeing an uptick of in my office is younger people coming in who have sensorineural hearing loss from damage to their hearing from listening to music too loud. And when you damage your hearing, that you actually end up developing tinnitus. But there's obviously a whole host of other potential options there.
Yep, there's no inflammation at all, Sheldon.
Then it must be a tumor.
Inflammation in the tympanic membrane or in the inner ear canal really just rules out infectious causes by bacteria. There still could be other things going on. There's viral causes, there's non-infectious causes, so you gotta really be careful.
Sheldon, what are you doing here?
Hang on. 130/80. It's a little high.
Yeah, because you're taking it yourself and you're not resting and your feet aren't flat on the floor.
All I need is for you to authorize these tests.
A cardiac stress test, a full body MRI, an electromyogram, a CBC, baseline glucose, upper GI.
What symptom is he having that he's requesting all these tests? Like, those tests are not even routinely done together, let alone in one patient.
You were right. Your larynx is terribly inflamed. I mean, I've never seen anything like it.
I knew it.
First of all, there's no shot she sees his larynx. That is ridiculous. She means his pharynx. The larynx is the voice box and it's much further back. In order to visualize that, you're gonna need a fiber optic scope to go inside the nose and actually go past the pharynx.
You're gonna need to stop talking immediately.
For how long should...
Immediately.
There are conditions where someone's vocal cords are inflamed, and we do encourage voice rest, especially post-procedural stuff. And by the way, in instances where your voice box is very inflamed, whispering people think will be easier on their voice box. That's actually more difficult for the voice box and provides more stress and inflammation and damage to the area.
Bernadette and I are getting married. Ma?
That's always worrying.
Oh my gosh, Ma. Stand back, I'm gonna break the door down.
Oh. Does he have a dislocated shoulder now?
So, how is she?
They're running tests, I don't know. May have been a heart attack or heart attack-like event.
So in some instances, when a patient's going to the bathroom and is bearing down, they can develop something known as a vasovagal syncope, where because they're bearing down, their blood vessels widen so that when they stand up, they actually don't have enough blood pressure to bring blood to the brain. And when the brain doesn't get enough blood, it makes the human body collapse in order to make it easier for blood to get to the brain. But that could be quite problematic because if you hit your head on the way down, now you're bleeding into your brain and you see where that goes.
Regardless, coronary problems are imminently treatable. What's more likely going to kill Howard's mother are the antibiotic-resistant superbugs festering in every nook and cranny of this hospital.
Hospitals do have higher rates of MDRs, multi-drug resistant organisms, but that's not to say that all hospitals have them. We're actually aware of what bacteria our patient population's exposed to so that we have our own guidance as to what antibiotics we should use based on local resistance rates.
Is there a history of heart disease in your family?
My family is the history of heart disease.
I've also never heard of a heart attack-like event. I've heard of a stroke-like event. That usually means a TIA, which is a transient ischemic attack. It's basically when a person experiences stroke-like symptoms, their speech gets mumbled, they lose ability to control a portion of their face, their tongue doesn't move appropriately, they pass out, but it's usually very short-lived. That's why it's transient.
Howard, I have to go to the bathroom and no one will take me home.
What's wrong with the bathroom here?
Pneumococcus, streptococcus, staphylococcus, and other assorted caucuses.
Those are different bacteria he's talking about.
Will you at least go with me to the restroom here so you can open the door and flush the urinal?
No!
Actually, in the restroom, there's probably more enterococcus, which is E. coli, and E. coli is the most common bacteria found in poop. When you flush a toilet, that's the moment you should really leave because that's when a lot of the pathogens and bacteria and stuff fly out of the toilet.
I think I'm too sick to go to the funeral.
You're sick? You poor kid. We'll see ya.
Sheldon, aren't you gonna take care of me?
Me? No. No, I'm not that kind of doctor.
Looks like she's suffering from a URI, an upper respiratory infection. See some congestion, rhinorrhea. Overall, looks okay. I wouldn't say toxic appearing.
102.2.
That is a fever, and that is what the body's supposed to do when one is ill.
Exactly what it was half an hour ago.
I'm not a fan of checking temperature that often. It's not gonna give you vital information unless something happened to you clinically, like you're suddenly feeling much worse, then maybe you check it again, but just repeating it every 30 minutes, every hour, it's not gonna give you any valuable insight.
Do you believe in the placebo effect?
Of course I do. There have been many studies proving its validity.
Yeah, great.
True.
Now, this may look like a Tic Tac, but it is really a powerful medication specifically designed to cure your illness as well as freshen your breath.
The way a placebo effect needs to work is not that just you need to believe in the placebo effect. You need to believe in the treatment that's supposed to be the placebo effect. And usually that comes in the shape of a doctor coming in with a fancy white coat or scrubs and telling you this will work, but only if you pay $29.99.
It's just common sense. Apply today.
Hey, Amy, I brought you some drugs we've been working on in the lab. This is proving really good for congestion, but there's a slight chance it can make your tears burn like acid, so if you take it, happy thoughts.
She looks so much healthier already. The color's back, the nose is less red.
I'm gonna draw you a soothing bath.
I don't recommend people to take baths when they're ill, just because it's gonna ruin the thermoregulation of your body. You're just not gonna get a lot of benefit out of it. If you wanna clean yourself, take a quick shower, but don't linger for too long.
This is a really good expectorant, although some test subjects reported lactating uncontrollably when they heard music.
A lot of these expectorants like guaifenesin or Mucinex, most people know it as, don't have actually great evidence for working. They also have a pretty mild side effect profile and rare side effect profile, so people tend to use them quite often, but they expect them to work miracles, and in many instances, they don't do much.
I don't need your medicine. I'm not sick.
I don't understand.
I got better 2 days ago.
I knew it.
It's just been so nice having Sheldon take care of me.
This is called Munchausen syndrome.
See the stuff in my nose? Rubber cement.
Oh!
Okay. Sweetheart, I have to go. I have a patient. No, you just stay off your feet. Remember, you're very, very pregnant. Yeah, I love you too. I know we're gonna have a baby.
I always find it weird when doctors take personal calls. If my phone's ringing and I really need to answer it, I'll step outside of the room because it just feels like it's disrespectful to the patient. It might not be, but I just feel like it is. So I don't know.
So, Mr. Harper, you want a vasectomy?
Yes. You do that, right?
Of course we do. In the exam room next door.
It is an outpatient procedure, meaning that you usually don't have to stay overnight unless there's some sort of complication. In fact, there's two ways of doing a vasectomy. There's the traditional vasectomy where you go in, they do the incision, they locate the vas deferens, which is the canal that allows the sperm to pass through. They cut it, and then they usually cauterize both ends so that it doesn't reattach, although it does happen sometimes. In the no scalpel approach, they just make a little hole where the skin is stretchy, stretch out the skin, gather the vas deferens, cut it right there, seal it right there, and then put it back in where you don't have to put sutures in.
I just have a couple of pre-snip questions.
Shoot. Which, by the way, you'll still do post-snip, if that was one of your questions.
Well, good.
Of course, if I've done my job right, you'll be shooting blanks, yeah?
Not right away. In fact, it's recommended post-surgery to get a sperm count and analyze your semen just to make sure that there's no residual sperm still present. In fact, one of the leading reasons why vasectomies fail is that people have sex too soon after the procedure, where you could still have some residual sperm that can last like up to 25 ejaculations.
All right. Let's have a look.
We don't position patients' legs into the footrests. We ask them to put their feet in the footrests because when you do it that way, it comes off as aggressive.
Okay, all done.
That was quick. You got a little mirror so I can check out the back?
Not that little.
Come on, honey.
Those are fighting words.
Breathe with me, breathe with me.
Why is he wearing gloves outside of the room? We don't do that. You take off the gloves if you go outside the room. And I'm pretty sure the gloves should be sterile. Those are not sterile.
Okay, let's start snipping.
Naomi, could you get that for me?
Hello?
Where is the sterile gloves? Where is the chloroprep? Where is the cleansing of the region?
Anyway, as I was... Oh, God. What's the matter? My chest. Are you okay? I don't know.
Chest pain in his age group with shortness of breath as he's experiencing it is a 911 call.
Let's have a look-see, huh?
The rhythm on the EKG is absolute poo-poo. That's not real. He would be dead.
According to your tests, you just had an acute attack of indigestion.
I don't know what tests would confirm that. You can rule out that he had a cardiac issue, but you can't confirm that it was indigestion.
The good news is that you are a perfectly healthy 50-year-old man.
You can't say that just because you ran a few tests to rule out an MI.
I'm only 40. Tell that to your liver.
Ooh. All handles.
Not so easy when I'm paying attention, is it?
Not so hard either.
Oh.
Ow! My head!
Oh, that's a head injury. Hitting the back of the head presents a lot of issues, especially when it comes to balance. Part of the brain that's responsible for balance sits right there in the back. And your visual cortex is back there as well.
Ah, you're gonna be fine. We just gotta stop the bleeding.
I'm bleeding?
The scalp does bleed a lot, so that's not necessarily an extreme reason to panic. More so if you're having neurologic signs, difficulty being able to see, weakness of the face, slurring of speech, unable to move your tongue appropriately, weird sensations in the arms or legs. In those situations, you want to move and be as still as possible and allow EMTs to come and transport you to the hospital safely on a backboard with a C-spine collar. I mean, his fall wasn't too hard, but the fact that he's bleeding definitely warrants an ER visit at the very least for staples. And we use staples on the scalp. It sounds terrible, but it's not that bad.
We need to see a doctor.
I just fill this out and have a seat.
No, you don't understand. He hit his head. He's bleeding.
Did he lose consciousness?
No. I got a little woozy, though.
A lot of people, when they see the sight of blood, they faint. Maybe it's like a protective mechanism.
Follow my finger. He's gonna be fine.
Whoa, that is not how we do a neurologic exam. We don't say follow my finger, eye muscles intact, good. There's other cranial nerves to check. Goes all the way up to 12.
Okay, you're gonna feel a little sting.
Nobody said I had to get a shot.
It's just to numb your skin so you won't feel the stitches.
What are you gonna give me not to feel a shot?
Sometimes we could use a cold numbing spray. If you feel cold in an area, that overwhelms the sensory nerves, whereby you might not feel as much pain when we do the injection of the lidocaine or whatever numbing agent we choose to use.
Go ahead, Doc.
Ow, ow, ow!
Hey, go easy on the kid.
No, you're squishing my hand.
There's also a good way to do it where off of a single injection, you can keep going amongst that spot so that you only feel one poke, even though you're doing it across a wider area. And I've kind of perfected that technique to make it less painful to do sutures, skin biopsies, shave biopsies, punch biopsies, all of these things. Once you perfect analgesia, it goes a long way, especially with pediatric patients.
How many stitches am I gonna get?
Oh, I don't know. 3 or 4?
That's all. Scott Pressman got 9 when his sister hit him with the Etch-a-Sketch.
I'm surprised they're doing sutures, not staples.
Help us out here, Doc. Okay, I'll go 5, but one's purely decorative.
The staple doesn't work like a traditional paper staple where like it hits against the skull. It more so grabs the skin and kind of folds in and holds it together. Even the way we remove it is basically a tool that grabs the staple underneath and then another part that bends it. And when it bends it, it actually pulls it out of the skin gently.
Coming down.
Ooh, ladder injuries represent a whole segment of holiday issues. We gotta create a safer ladder, like a ladder that has an auto safety in it or something. I'm surprised a fall from that height only created a neck and hand injury. No hip, no leg, no rib? Seems sus.
I have abrasions, contusions, a severely sprained neck, 2 fractured fingers.
A severely sprained neck wouldn't necessarily require a C-collar like that. Oh, sneezing when you have a broken rib is the worst thing on the planet. Or low back pain, actually. I've had that happen to me.
Oh.
Charlie?
What am I witnessing?
Do I look okay?
Sciatica?
What happened?
I pulled my back. Alan, you're a chiropractor. Do something.
Okay, let's see what we've got here. Is this tender?
A little.
On a scale of 1 to 10?
I don't know. 3?
Looks like he's palpating the thoracic spine, the lower thoracic spine, getting to the lumbars, maybe in the paraspinals, the muscles that surround the spine.
Okay, I'm better.
No, you're not. Now stop moving.
Really, I'm fine. Just don't. 10. That's a 10.
One of the tests that we do in a situation to diagnose sciatica is called a straight leg raise. And we see by stretching and aggravating the sciatic nerve if that reproduces symptoms.
Come on, let's get you back on the bed so I can give you an adjustment.
No. New plan. I need someone who can give me drugs.
And actually for sciatica, a lot of the things we do have pretty low evidence levels, but we have to do something. So very commonly we give over-the-counter medications like acetaminophen, which is Tylenol, or non-steroidal anti-inflammatories, Aleve, or Advil, Motrin, ibuprofen. Sometimes we give prescription ones like meloxicam. Other times we give muscle relaxers. Sometimes if there's very serious nerve pain, we can give steroids, which I try to avoid in many conditions. Physical therapy is my mainstay of treatment because that allows the nerve to calm down, helps secure the back. You can do mobility, you can do strengthening, and then work your way up to stretching. And then we always have, obviously, as a last resort, spinal surgery, but I'm very much not a fan of getting there unless absolutely necessary and the symptoms are that bad.
I could help you, Charlie. I've already isolated the source of your discomfort. All that's left would be to realign your vertebrae through a gentle series of manipulations and stretches, thereby alleviating your pain.
How does he know that it's due to a vertebral misalignment? That theory doesn't really hold up. It's been largely disproven, actually, in many of the instances. That's why, like, when people say your back pain is terrible because of your posture, it's like, is it because of your posture, or is your back pain bad, therefore you develop bad posture?
Did the pain start in your lower back?
Best I can tell, it's a spasm between L4 and L5.
That's not where he was palpating earlier.
Okay, I see here your last visit was 4 years ago, a mild hernia brought about by Okay, I think I'm seeing a pattern here.
You know what's interesting? As a side effect for, I don't remember if it was Viagra or Cialis, but it could actually cause very severe lumbar pain as a side effect. Because if you increase circulation and vasodilation to some of the specific veins of the back, it could actually create very severe back pain, and it's a known side effect. I wonder if that was the cause, especially given the fact we knew the history. That would be my next question if this was my patient.
So what's the course of treatment here? A pill, a shot, maybe one of those epidurals?
We'll see. First, I'm going to get your blood pressure and take some x-rays.
I don't like when we jump to x-rays for a non-bony issue. Like, it's very clear that this wasn't a bony problem, given the fact that he was laying down, there was no trauma. He clearly pulled his back muscle or has some sort of muscular or connective tissue problem. So if that's the case, let's treat it conservatively. Let's give him some time and see if it improves. Jumping to an x-ray is largely getting information that's not gonna help, definitely create potential harms, and the trade-offs just usually aren't worth it.
No fractures, no dislocations. Looks like just a simple muscle spasm.
Why would there be a fracture? I don't understand. He's a healthy young adult. Why? Why fracture?
Okay, I'm gonna give you a shot which should ease the pain and also allow your muscles to relax.
What kind of shot is this? Is this a Toradol injection?
Have you had Demerol before?
Hold on, isn't Demerol an opioid? Yeah, Demerol is a narcotic. Why in the world is she hitting him with a narcotic? This is clearly at peak opioid crisis days. We would never do this now.
Could you please wait outside? I need to give your brother a hernia exam just to make sure he hasn't re-injured the area.
A hernia exam?
Turn your head and cough.
Do you know why we do that? Because when you cough, you bear down, we could actually feel the hernia or the abdominal contents poke through the hernia if there was a hernia. Why the head turn? Because we don't want people coughing on us.
I've been shot! Oh my god, oh my god, oh my god.
Over here.
All right.
Ron, I got your hat! Ron, I have your hat!
Why is no one calling 911? Why do they think they could solve this? Like this is an office issue.
I was shot in the head with a shotgun.
Hey, Ron, it's actually not that serious. I just need you to stay calm, okay?
Yeah, I'm just gonna stay angry. I find that relaxes me.
Okay, here's your scotch.
Okay, Jerry. Jerry's here. Here's your scotch, Ron. There we go, Ron. Okay.
Scotch can actually make you bleed more, so that's not something that we want.
The pain medication I gave you is pretty strong. Donnie uses it for menstrual cramps. How many did you take?
7, 8. But I washed them down with plenty of fluids.
No, Ron, you cannot drink scotch with this. You're gonna need to purge right now.
Pain medications, especially ones that include acetaminophen, aka Tylenol, with alcohol can be quite disastrous. In fact, one of the leading causes of acute liver injury happens to be Tylenol intoxication, whether on purpose or even by accident. I see it quite often when patients are like, oh, I took some Tylenol and then I took some quercetin or NyQuil. These are all things that contain acetaminophen, but because they have different brand names, people don't realize it and they like get a toxic dose of Tylenol. We recommend ideally maxing out at 2,000 milligrams of Tylenol a day, but the max dose is 4,000.
This is for your own good.
I will bite you.
Open your mouth.
Listen, get...
If they had an Ipecac, this would make it a lot easier.
Hey, Anne, are you still a nurse or did they fire you because you slept with all the doctors?
Whoa, someone belongs on Grey's Anatomy.
Andy's not feeling well.
What's wrong, Andy?
Just got a headache, and I'm seeing double, and I got a song stuck in my head, and my teeth hurt. Also, I'm hungry.
Not gonna lie, most of my patient visits go exactly like this. For us doctors, we wanna address one concern at a time in order to give it adequate time and effort. But patients don't work by check boxes. So they tell you everything that's wrong with them, and then we have to decide, is this all due to one cause, or are we gonna take this apart in several visits?
Did you hit your head?
Yeah, he was hanging up his gold record. Oh my God, are you okay?
Yeah, I'm good.
Look to the left, to the right, whatever.
The best fundoscopic exam I ever seen. You can't do a proper fundoscopic exam when the patient looks so far to the left and so far to the right, because you gotta look through the pupil.
Well, if it's a concussion, it's extremely mild, so I wouldn't worry about it. Anything else bothering you?
The way that I like to do it is say, okay, based on reason X, Y, and Z is why I don't think this is inherently dangerous right now. Things you need to be on the lookout for are X, Y, and Z. The patient can then understand why I'm making the recommendation, to understand that if something changes that now is outside of my initial recommendation, they know when to come back.
I've got a weird rash in my knee pit. Sometimes when I walk, my ankles make like a weird rattlesnake sound. Broke my thumb on the way over here.
Whoa, that's a serious break. There's a lot of bruising.
We made like 100 million doctor's appointments for ourselves in 1 week. After this, we won't have to go to the doctor for like 10 years.
That's not true. But seeing a family medicine doctor is really ideal because a lot of these problems are really not requiring the consultation with a subspecialist. We can handle them in family medicine. So Dr. Harris seems to be a lacking.
Oh.
Let's get you home and get me some ice cream.
Here's your bill.
Oh, yeah, we won't be needing that. I've got the free medicine card.
Free medicine card.
Deductible for dental procedures.
Oh, I think you're wrong. We have the insurance thing. I believe we're covered.
It's still $500.
You know what? Let's go! Dine and dash. Out of the way!
Wait, he got a dentist appointment and then he's in an ICU all of a sudden? Where is he? Oh.
Call an ambulance!
I'm making the water fountain hygiene upgrade our #1 priority.
Great. For some reason, when people in Pawnee use the water fountain, they put their mouths completely open.
Ew! Oh my God! That's my worst fear. Oh, it's a surefire way to get herpes, speaking of it.
I have a hernia. This morning, I made the mistake of sneezing.
Oh, that looks like he has an inguinal hernia where intestinal contents actually go through the inguinal canal into your scrotum. That's right, you can end up with intestines in your scrotum.
But as long as I sit still and don't move, I'm good. I got this.
The most dangerous part about having a hernia is if it becomes strangulated, which means that within the opening that was created and that it went through, some kind of inflammation happens or stress happens where it starts getting choked out. And this choking out actually cuts off the blood supply to that part of the intestine, thereby causing it to necrose and die, which leads it to develop an infection. So a strangulated hernia is a surgical emergency. That was actually really funny.
But the best part about being an MRI technician is I can see inside everything. I look inside this steak or this butter or this bread.
Well, if you look inside this bread, all you're gonna find is more bread.
I don't know, I'd have to do an MRI.
I mean, I've never even had an MRI before.
What?
Is he taking her to get an MRI in a claustrophobic, loud little space that you have to sit for long periods of time? Ugh.
I don't know about this.
I'm offering you a free scan. Usually costs up to $2,000.
Free scans are not necessarily good scans. In our bodies, we have all sorts of little growths and differentiating markers. Some of these things go away. Some of these things aren't actually a problem. If we find them on imaging when we're looking for something else, we actually have a name for them called incidental omas. And these things are not usually meant to be found. Finding them just results in more scans, more radiation, more healthcare related anxiety, more testing that you don't need. And the reality of us actually trying to save your life by finding this thing are almost zero.
How's that feel?
Weird.
Perfect.
How about asking her if she has any metallic objects on her? Oh, so much can go wrong.
You never had any kids, right, Leslie?
No.
You've got a great oven.
Okay, time to go.
You got ample room in there.
What is this even an image of?
You got a big industrial-sized oven.
I'm feeling sweaty. Do I look sweat? I feel... You know, I need to use the bathroom one more time.
It's like 5 times in an hour.
Well, somebody's nervous about the ceremony.
Or he could have a UTI, causing him to have a fever, which is causing him to sweat, which is causing him to urinate quite often.
Ken? Oh my God.
Kidney stone?
Are you okay?
I think I'm giving birth.
Kidney stone?
Yep. Big sucker, too.
Big sucker. Size is one of the most important factors when we're looking at kidney stones to decide what to do moving forward. You know, lithotripsy is a really unique option where we can actually break up the stone while it's inside of you. But we could also go in and physically retrieve them.
I want candy.
What is he on?
Morphine. It's good stuff.
We could also give medications like Flomax, which can help in the passage of smaller stones.
Ron, you've been sweating in here all day.
Oh my God, why is everyone sick?
Yes, plenty.
No, you need to drink water.
Usually I take it neat, but I will make an exception in the name of health. Last night I watched a movie with Diane and the girls in which an orange fish is separated from his father. The children were sniffling, which I believe to be due to the sad nature of the film. I was wrong.
Kids are petri dishes. They touch everything, they bring it right up to their noses, mouths, eat it, then get sick, and then pass it along to us.
I'm a grown man. I have had a cold before. I need no help. So, if you don't mind.
Oh no, he fainted. Make sure that he has a pulse, otherwise start chest compressions.
Before you begin, a few ground rules. I need you to explain everything you do before you do it so I can determine whether I will allow you.
It's funny, that's what I usually do with my patients. But the other day I had a patient who I was draining an abscess off of his back, which means that it was like a pocket of pus, tennis ball size, almost like what you would see on Pimple Popper. And as I was doing it, because it was on his back, I wanted to narrate what I was doing before I did it so he would feel comfortable. He actually got mad at me multiple times. The first time he said, please stop telling me everything you're doing because it makes me feel worse. I apologized. And then when I realized he was taking it a little long, I reassured him and said, everything's going well. And he reminded me, please stop telling me what you're doing. And I made the mistake and I apologized again.
Balsa wood? You could at least use mahogany.
There's something occluding your ear.
It's sawdust. Just blow.
Why does he have sawdust in his ear, not earwax?
You've got strep throat. Writing a prescription for penicillin.
Why was he admitted into the hospital? A, for strep throat, and B, why in the world are his eyes so red for strep throat? Something doesn't add up.
Hey, you look better. I guess actual medicine can be effective. Who'da thunk?
Please leave me alone.
A lot of people don't realize this, but by taking antibiotics for strep throat, you only decrease the time that you have symptoms by about 16 hours. That whole, oh, I'd like to get antibiotics so I can get better for my trip thing, doesn't quite work.
The only problem I see is that your potassium's low, so just eat a banana once in a while.
Ladies.
Does he have a gag reflex? What's happening? The ASMR of it all. Oh, that's disgusting.
Let's go wait outside the bathroom for Tom and scare him. Ready, and...
Jerry, God, gross.
Guys,
Oh, God. Oh, I think he might be having a heart attack.
And farting simultaneously?
Medically speaking, how would you describe what happened to Jerry?
He had a mild heart attack.
Is there a term for having a heart attack while releasing so much gas?
Not really. Gastrointestinal distress is common during a cardiac event.
It's common during any stressful event, actually. That's why the term butterflies in my stomach exists.
I just want to hear the doctor say that Jerry had a fart attack. Is that too much to ask?
You could just have said it yourself, my man. And if you're having a heart attack, the most important thing you can do is call 911 because the time that we have to save your heart that is not getting enough blood flow is limited. And if you're not getting there in time, we could actually lose parts of your heart, which then can lead to rupture of valves or walls of the heart. And obviously that could be lethal. If you're having chest pain, you're dizzy, it's radiating up, down, left, right, call 911. In fact, here's the recommended guidance from the American Heart Association.
I'm just feeling really tired. I think maybe my allergies are acting up. I've already vomited like 5 times today.
Vomiting can be a sign of anaphylaxis. That's something we don't talk about enough because people are saying, oh, I'm vomiting, that has nothing to do with allergies. It can be. From a skin allergy, very unlikely, just like a mild skin allergy.
Oh my God. Oh my, is she sick? Are you sick?
No. Yeah, she's sick. That's why I'm wearing this and misting myself with hand sanitizer.
Yeah, that doesn't work. And it kind of reminds me of the new Dyson product that was just put out. I have questions about that thing.
I'm getting better.
All right, you're burning up.
You're burning up. What?
The fact that she's having multiple systems involved, watery eyes, runny nose, abdominal discomfort, vomiting, all of that point to the fact that it's a multi-system issue, likely to be a virus.
Leslie, I typed your symptoms into the thing up here and it says you could have
cancer.
Network connectivity problems.
That's actually really funny.
104.1.
That's high.
Leslie, you're dehydrated, I'm admitting you.
Well, temperature is not correlated to dehydration. If she checked her skin turgor or evaluated her lips being very chapped or checked if she was tachycardic, all those things can point to dehydration. In fact, there's something we can note on the chart, dry MM, which means dry mucous membranes.
It's food poisoning. I have it too. I did not sleep for 1 second last night.
Did they vomit?
I cracked the bottom of the toilet bowl.
Oh, God, don't say that.
It's important that if you have food poisoning that you don't take motility slowing drugs like Imodium, because your body's trying to get rid of the toxin, and by slowing down the motility of the intestines, you can actually keep that toxin in longer, creating a bigger problem. Warning signs in your stool that you could have a really bad infection: blood, mucus, changes in your stool caliber, fever, worsening lower abdominal pain. The blood is one of the main ones though.
All right, moving on to recycling.
You okay, Ron?
Just a little tooth pain. I'm fine.
Do you need to go to the dentist, Ron?
I don't like dentists. Just a second.
Hey!
No.
Oh! Don't extract your own tooth. No. Worse than Jack.
Dentist pulled the tooth out yesterday. But it's always a good idea to demonstrate to your coworkers that you are capable of withstanding a tremendous amount of pain.
Why did he have to have a healthy tooth extracted? Could've just get a root canal.
Hey there, Sarge. Not to pry, but I couldn't help it over here. You going to the doctor? Everything okay?
HIPAA, my friend.
I'm getting a vasectomy.
My ears are burning.
Why is everyone involved? There's no patient privacy.
You're gonna let some quack doctor just knife around down there?
Why quack?
That's enough. I don't need any more input.
Neither does your wife, I guess.
Oh.
Look, you guys, if the sergeant wants to chop off his penis, that is his choice.
That's not what happens during vasectomy. It's called a vasectomy because it's of the vas deferens, which creates a vast difference in your ability to conceive. I just made that up on the spot. They are reversible, but we like to think of them as irreversible so people don't just do them willy-nilly. There are really rare instances of a vasectomy failing.
Anybody else?
God, no need to be so testy.
Guess you won't be manning the tip line.
Sergeant, is this gonna go on your sperminate record?
Sperminate record?
How'd it go? Is his voice all high-pitched now? What? No, of course not. Of course not.
It doesn't impact the testes.
He's on a lot of medication. We weren't able to do the procedure. Your friend is so large.
That you needed a bigger saw to get through his dingus?
No, his body is so physically massive that we didn't have enough anesthesia on hand.
So what, he just got anesthetized and then they sent him home?
So he has no filter whatsoever? None. I'm gonna take you home now, Sarge. Hey, what do you think of Captain Holt?
Oh, he needs to smoke some weed.
Yes! Thank you, Dr. Penis Off.
That's Dr. Urologist to you?
All right, let's get started. Scully, where are you on digitizing the old case files?
As of yesterday, I'm officially 1% done.
Why are you smiling? That's nothing.
Or there's thousands of cases, and for each one, I have to fill out 200 little box thingies on 50 different screens.
That sounds like what I have to do every time I log a patient's chart. The other day, it asked me when I was examining an infant whether or not this patient was a never smoker. Let's be real.
At least you get to sit on your butt all day.
That's actually the worst part. My doctor said I have an anal canyon.
An anal canyon? Canyon? Is that like a pilonidal cyst, also known as a Jeep Wrangler cyst from the Vietnam War days? Sitting, by the way, I know people like sometimes exaggerate and say it's as bad as smoking. Okay, it's just not that bad, but it's not good for you, especially for really extended periods of time. The blood stagnates, higher chance of forming clots, you decondition. In general, you wanna keep your body moving, and that's why frequent breaks after at least a couple hours, you wanna be moving your body around, circulating that blood, the lymphatics.
God, Scully, why are you always telling us about your disgusting body? I don't see anything.
That's because it's all wart.
It's because it's hogwart?
All wart.
It looks like he put betadine on his foot to disinfect it. And that should be a no-no in the dining department.
That's a PUW, or portable ultrasonic weapon. It emits a focused beam of sound which can disorient and even incapacitate a perp.
Is that what was done in Serbia the other day? Something wild happened and all the people in the crowd dispersed. Supposedly it was like a supersonic weapon. Have you heard of this?
No.
Have you heard of this?
So it shoots sound? Is this a trigger?
Yes, but you want to be careful with that.
Thought it would be louder.
It's highly directional. If it were pointed at you, you'd be in incredible pain right now.
You can rupture someone's tympanic membrane like that. That's not fun.
There's been an outbreak of the mumps.
Ooh, mumps.
Mumps.
You get swollen glands in the face. Parotis? Parotitis?
I'm afraid you both have the mumps.
Why did they get vaccinated?
Are we gonna die?
No, it's a self-resolvable condition. You may need supportive care, but being young and healthy helps.
Due to the highly contagious nature of the virus, you will both be quarantined to your houses for the next 9 days.
And I'm pretty sure you have to report that to the Department of Health.
I'd like to introduce you to someone. His name is Simon.
Oh man, that's the parotid gland.
Hello, Simon. This is Balthazar. He's an evil demon who spits fire in my throat.
Goiters, huh?
They're not goiters.
What is it? Did you see something?
No, I just got very cold very fast.
That's developing chills. That's how your body builds up a fever. You actually shake with the chills, and then when you shake, you create excess heat, so your body raises its basal body temperature. And then when you do something like take Tylenol or ibuprofen, your body lowers that fever by sweating.
You're quarantined. You can't go outside spewing mumps like a couple of mump fountains.
Not like this, we can't.
But why aren't they vaccinated? I wish they would have at least put them in N95 masks.
Most of the killer's incisions are very sloppy, but then once he gets to the heart, they become very careful. I mean, look at the vena cava. That's a clean cut. Game recognized game.
I don't understand. Did someone steal someone's organs?
Caleb, we're tracking a serial killer, and I was thinking you could help us get inside his head.
Just because I ate humans doesn't mean that I'm inhuman, Jake.
Caleb, come on, that's not what I meant.
It means you're a cannibal.
You know what? There was some weird guy on the forum recently.
Do you know anything else about him?
I'd never seen him on there before, but you could check the logs. I'll approve you. I'm an admin. Oh, you might want to switch to incognito mode. Otherwise, your targeted ads will be pretty cannibal specific.
What targeted ads do cannibals get?
Good knives.
Good knives, cutting boards, saws.
All kitchenware. Anything Nick DiGiovanni is selling?
Yeah. Makes you wonder.
No, I'll tell you one thing. You are not looking for a cannibal.
Why do you say that?
With all that blood, no self-respecting cannibal would waste all that sauce.
Sauce.
Those are some nice tools. I would love to spread some ribs using that sternum retractor, but they only sell those to hospitals.
Oh, they would give surgical equipment. That's the ads you'd get. It would think you're either a doctor or a cannibal. Most doctors probably get the same ads as cannibals. I should clarify that. Surgeons.
We're not looking for a serial killer. He stole the hearts for a transplant.
Boom, we solved it. Boyo, give me a hug.
Here's where we can see him.
There's a heart in the cooler.
Sorry, Rinaldi. The only transplant happening today is your ass to jail. He is definitely unconscious and didn't hear any of that, but I'm still pumped. Case closed, let's go.
Most of these organs, especially the ones that are highly vascular, last a matter of hours, not days.
Ah, shortcut. You just got jaked.
Oh,
Jake, you okay? No, Serge. I got hit by a car.
Mechanism of injury is one of the most important factors to know how bad an injury will be.
You could have died, man.
I wasn't hurt that badly. The doctor said all my bleeding was internal. That's where the blood's supposed to be.
No, it's supposed to be in the blood vessels, not just floating around inside your cavities. There's levels to internal. There's internal cavity, and then there's internal blood vessel. It needs to be in the vessel. And when I say vessel, I mean artery, vein, capillary, you know.
Santiago, I'm gonna come at you and you're gonna take me down. You better impress me if you want that recommendation to be good.
I'm gonna try, Sarge.
Here we go.
Oh, that's a lot of blood.
If it helps, I brought you some soothing ginger tea.
Will it repair the place where my nose came off my skull?
I don't know, but it's supposed to have healing vapors, so try inhaling it.
Is something bad gonna happen? I think ginger's totally fine for the nose. It burns?
The vapors burn!
Sorry, I'll take it down!
Oh, no, second-degree crotch burn.
No, don't! I am petrified of you.
I never understood those drive-thrus where people get a hot drink, they spill themselves and they sue and then win. This just happened the other day in Starbucks. Like a huge sum of money.
Die, pig!
Oh, did he get shot in the butt? That's the glute max, glute med, maybe even the femoral neck.
Bubba back in the 9-9.
Why is his abdomen taped up if it went in his butt?
What are you wearing there, buddy?
Oh, none of my pants fit over my butt cast.
Oh, it's a butt cast. Did you need a butt cast? You would think that he probably shouldn't be moving around if he truly fractured his hip. We actually call that non-weight bearing.
We're doing a diet together. My wife found it. She heard about it at Mommy and Me Graphic Design. Wait, It might have been Tyler Karate. She takes our little ladies to so many classes, I can't keep it straight.
Childhood is truly a time of wonder.
This diet is very scientific, sir. All the meals are pre-planned and delivered to your doorstep.
That's helpful because you don't have time to make them.
This is our breakfast.
An orange wedge, 3 cashew nuts, and a solitary grape.
Dr. Gundry would not approve. He would say, might as well have a chocolate.
Might as well. This seems unnecessary to me. You're all in perfect shape.
You can always be healthier, sir.
And I like the challenge.
Plus, it's good team building.
Health is not about a number on a scale. The number can be very extreme on that scale, leading to a higher likelihood of unhealthiness. But just because your weight is good doesn't mean your health is good.
Pro tip, lick the baggie. There's food molecules in there.
No, there's PFA molecules in there.
Quick reminder that today is Sergeant Santiago's last day before maternity leave.
Yes.
We'll see you in 3 months.
She gets 3 months off. Can I take a maternity leave?
Are you giving birth to a baby?
I'm having a 7-pound mass removed from my abdomen next week.
Oh,
yeah.
A 7-pound mass? A fibroma? It could be a lot of things, obviously.
What was that?
You need to go to a hospital right now. I don't want a birth happening around me. It's way too gross.
I'm nowhere near giving birth. I haven't even lost my mucus plug.
Amy, you need to get the out of here.
Most hospitals have generators, so they should be okay.
Okay, your contractions are 3 minutes apart. It's officially time to go to the hospital.
Not yet.
Do you know how thin your cervix is right now?
Ripening. These are actual terms we use, by the way.
You made me a birthing suite?
Who's gonna deliver the baby?
I know you're in a lot of pain, but we don't have any meds here. You just gotta try not to focus on it. Can you distract her?
I was just checking to see if there's anything we can do to help. And I hate to say it, but I think there is.
Meditation? Distraction doesn't work for pain control.
I'm here!
Oh, Jake!
I can't believe I made it!
He's gonna faint. Actually, one of my patients that I helped deliver her baby as a resident just commented on one of my Instagram posts a very lovely message.
We did it, Ames. We made the world's hottest baby.
Say cute, Jake.
Yeah, hot, it just weird context, sir.
Okay, we have a few more questions for you, Doctor.
Doctor, huh? It's funny when people call dentists doctor.
We are doctors. We do 4 years of medical school.
That was called dental school.
You know, it's actually harder to get into dental school than medical school.
Oh, I wonder if that's true.
Most people want to become actual doctors.
That's ridiculous. It's not like we're college professors calling ourselves doctors.
They're not PhDs, that's for sure.
Maybe let's refocus.
No, the problem here is that medical practitioners have co-opted the word doctor.
Okay, Captain.
Now, I know we live in a world where anything can mean anything, and nobody even cares about etymology.
Apparently, that's a trigger for me.
Yeah, apparently.
There is not a single thing on here that you are too old to do. In fact, if you did everything on the Murtaugh list, I'd call that a pretty fun weekend.
What's the Murtaugh list?
Barney, you are not 18 anymore. If you did everything on that list, you would die. That wasn't
Challenge accepted. In the next 24 hours, I'm going to do every single thing on this list.
Now, as a doctor, I need to see this list before I give the A-OK. I'm just kidding. That's not what a doctor's role is. A doctor's role is to warn you of risks and dangers and allow you to make the decision for yourself. That's called bodily autonomy.
Robin, there is some pretty tough stuff on that list. Do you really think Barney's gonna get his ear pierced?
Get ear pierced. Check.
Oh, he's bleeding heavily. Most people that get their ear pierced don't bleed that much. I hope he didn't just stab himself in his cranium as well as going through his ear.
You guys mind if I crush on your futon tonight?
We don't have a futon.
Put it over there, boys.
What's going on?
It's on the Murtaugh list. Crash on a friend's futon instead of getting a hotel room.
Ooh, I am too old for that stuff.
What's going on with your ear? It looks like the inside of a jack-o'-lantern on November 3rd.
The problem with ear infections, and it's not so much with an earlobe infection, it's more of a middle ear infection situation, is it can actually spread to the mastoid bone, which is attached to the occipital portion of your skull. And that area, the mastoid process, if it gets infected, it gets inflamed, it gets painful, and you require IV antibiotics. It's pretty ironic. So many parts of the body are called process, and that just means bone sticking out. Like a protruding bone is a process. So you have the mastoid process, you have the spinous process on the vertebrae. There's gotta be another process that's gonna come to mind. All of these.
This bet is over. Your ear looks like a free Danish at a continental breakfast.
I mean, at that point, it's just full-blown cellulitis requiring soft tissue antibiotics. He also might be having a reaction to the metal in that earring. That also happens a lot with nickel allergies. It's one of the most common metals to have an allergy to. People call it a cheap jewelry allergy. I think nickel's cool, so I don't call it cheap, but you know, to each their own.
Speaking of food, Marshall, I got some bad news. Just read online. Gazzola's is closing.
No. What's Gazzola's?
A filthy mecca of spectacular, if undercooked pizza located at 316 Kinsey Street, Chicago, Illinois.
New York pizza is the best pizza. Don't tell me otherwise, please and thank you. Brooklyn pizza, to be specific. Staten Island up there as well. And the only correct way to order a pizza is with extra cheese pepperoni. Don't tell me otherwise, unless you're my cholesterol, then you're allowed to tell me otherwise.
Those Gazzola's trips, that's where we really became bros.
We ate nothing but jerky.
Drank nothing but Tantrum.
Tantrum was a soft drink with the highest caffeine content legally available over the counter.
Oh my God. This reminds me of Prime, with the Prime Energy having a huge amount of caffeine content and how it's being marketed to kids and how that turned out to be a huge disaster. It actually also reminds me more of Four Loko. That was a problem. People are getting palpitations. They were getting sick off Four Loko. And for those who don't know, Four Loko was like an alcoholic beverage that wasn't incredibly high in alcohol content, but it had some, but also had a mega amount of caffeine. And it was also huge serving size too.
Those trips were brutal, right? The long hours in the car, the motion sickness, the smell.
So what time are we leaving for Gazzola's tomorrow?
I was thinking 9:30. A little rubbery, room temperature, kind of gross.
Making me wonder if this pizza is worth the 22-hour drive.
22-hour drive. That's a blood clot if I ever heard one. I'm just kidding. But that does put you at risk for having a blood clot. Long drives, long flights, post-surgery. If you don't move, you have a higher chance of having a clot form in the veins of your legs. Because actually, when you move around and you take steps, your calf muscle squeezes, therefore it helps some of the blood flow from the veins come back up. But if that blood pools and stagnates in the area because you're not using your calf and pumping well, as a result, you could form a blood clot. The danger of having that blood clot is having that blood clot get loose from that area, get shot up into your circulation, into your lungs, creating what's known as a pulmonary embolism. Because it lodges in your lungs, blocks blood flow, and the lung dies.
Just like old times.
I feel so young again, except for the chest pains.
You know what's funny about pizza is it's one of those foods that is really like a triple whammy in terms of potentially being unhealthy. You consume a lot of sugar that can lead to high triglycerides, higher blood sugar levels, which can increase inflammation in the body, all sorts of vascular issues, vascular inflammation. But then on top of it, you have high sodium content, which can increase blood pressure. Then on top of it, you have high fat content, which can raise your cholesterol, leading to blockages being formed. So you have like blockages plus inflammation plus high blood pressure, a lot of strain on the heart and kidney. I still love pizza. This isn't a pizza hate video, I'm just saying.
Got my stomach!
Ooh.
Damn you, Gazzola's!
Oh, food poisoning is terrible.
It's like a hot ball of lead! Baby, cut it out of me! Cut it out!
You know what's funny? When we study in med school specific foods, reheated pizza is not one of them, but there's certain ones that they test us that they ingrain the types of bacteria that those foods tend to harbor and then cause illness with. So like reheated rice has B. cereus bacteria. Potato salad has like salmonella. Deli meats have listeria. We even have some for animals. Like if you own rabbits, maybe you have tularemia. If you have parrots, maybe you have chlamydia. I'm not exaggerating that. That's like still ingrained in my head from the medical boards.
130, what?
They didn't have Uber back then.
I'm Batman.
He got hit by a bus.
BTW, there's one bone downstairs that ain't broken.
That's not a bone.
Up top.
Are you sure?
Yeah, dude. Why do you think I had him set it this way?
Okay.
Oh, that's kind of hurt. You know what's funny? He's wearing the C-spine collar. We wear that usually to stabilize the C-spine until we clear it, until we get proof that there's no fractures or danger to the cervical spine. And it's very clear since he's been bandaged up and he has casting on that the x-rays are already complete. So that thing would have come off by now. It's also really important when you have casts on the lower limb to keep them elevated to allow the lymphatic fluid to drain and not allow it to swell, because if it swells, pressure can build up and it can create all sorts of problems.
I had to look away because if I watched what the paramedics were about to do, I would have passed out. Then they took out this electric blade thing, and I kept thinking, this isn't happening. This isn't happening.
The electric blade thing is probably an oscillating saw to take off a cast.
Oh my God, what did they cut?
My suit.
Oh.
My beautiful suit.
It's actually really cool if you ever seen a cast saw. If you put it on your skin that's soft, it kind of just bounces your skin around. But if you put it on a cast, which is a surface that's hard without elasticity, it's actually gonna cut through the cast because it vibrates so hard. There's actually some really cool slow-mo footage. Here, maybe we can play it.
I'm afraid you're allergic to lobster. You can never, ever, ever have it.
Is it lobster or just shellfish in general? Which is usually somehow tied to iodine. Is that like the white bear principle where it's like, or white elephant, where I say, don't think about a white elephant, and you're definitely gonna think about a white elephant?
Oh, this is delicious.
Oh man, that's serious angioedema. I'm worried at this moment because she doesn't have an EpiPen. We could get into trouble. You know, there's actually immunotherapy that you could do with like sublingual tablets or injections that can help overcome an allergy. Pretty cool stuff.
I don't need to go to a heart doctor. I drink every day, I sleep 3 hours every night, and I have multiple sex partners. I'm doing everything right.
Well, not sleeping is not great for the heart, especially long term, because that puts you into sympathetic overdrive where you're in fight or flight mode, which means you have high cortisol, you have high blood sugar, you have dysregulation of your blood pressure, then you're drinking large amounts of alcohol, which is cardiotoxic. Yes, alcohol is cardiotoxic. Sexual partners, probably the one that contributes the least to the heart. I guess if you're having lots of sex, it's like you're exercising a decent amount. So maybe your heart healthy for that reason.
Well, Barney, your heart sounds fine.
See, Lily? She was worried.
Although it seems like you might have a slight arrhythmia.
I'm assuming he's gonna have like a PVC.
I'd like you to wear this heart monitor for the next 24 hours.
It's called a Holter monitor. We have patients wear it for 24, 48 hours if they're having symptomatic arrhythmias or we find an incidental arrhythmia. What's cool about the monitor is obviously that's an older one. The newer ones, they have like a little connection to your phone where if you're experiencing some of the symptoms like palpitations or pain or something, you could press a button on the phone, which actually marks the area of the electrical rhythm when you're experiencing it. Because some patients may come see me and they say, I feel fine right now, but sometimes, doctor, something's going on in there. What's cool is with the Holter monitor, I can actually go back in time and look at the moment where they pressed the button, what was going on with the heart.
Flag on the play, Doc. I have a date tonight.
Don't worry, it's totally safe. Unless part of your big date involves connecting yourself to a car battery.
Well, now it doesn't.
That was like a really weird choice of humor. I don't know, I don't get it.
Okay, everything looks fine here, although I did notice a few irregularities. There's nothing to be alarmed about.
She's probably pointing out PVCs, which are premature ventricular contractions. Not incredibly scary, especially if they're asymptomatic, meaning you don't feel anything with them. Young people can have them. They kind of just pop up because sometimes treating them or trying to treat them will actually lead to more complications as opposed to just leaving them alone.
Nora's great. She's wonderful. But
What time was your dinner reservation?
last night, 8:30.
What did his heart do at 8:30?
It literally skipped a beat.
That's cute.
Your heart's talking to you, Barney.
Oh, he
Do you have the
loves
guts
it.
to listen to it?
Oh my God, does he have heart block? If he has like a 2nd-degree heart block, Mobitz, I'm paying attention.
What do you mean I can't have an epidural?
You're too far along. Things are moving much faster than expected.
Look, if your hands are tied medically, just leave the epidural on the table and walk away.
How are you gonna put it into your spine?
Lily, I know this isn't how you imagined it, but I want you to know that I am here for you and I am rock solid. Oh, I can see its head. Oh, thank God, Dr. Sonia!
You! Get that thing out of my delivery room!
Where are the nurses? Where is the support staff?
We push now, yes?
I can't. Marshall's not here yet.
Lily, if you don't push, I will shove that baby up your throat and pull it out of your mouth!
Yeah, we don't do that, sorry.
Everybody?
Oh, that baby's like a month old.
Named him after my pop.
Maybe not a month.
Tell him the full name.
Where do they get babies from for TV shows? Like young babies. Do people rent them?
I think young babies literally have agents and stuff.
They have agents? How do you make a baby and go, yo, you want it?
They get them from somewhere.
I don't want to study for a math test.
I hate math.
I don't want to study.
Now you don't have to.
This is like the new infomercials. I feel like this should be on Goop.
Just pop one in your mouth and you'll be sick all day. Wow.
What? Who wants to be sick? Oh my God.
Chickenpox cherry.
Ew.
Pneumonia orange.
Ew.
Bleeding gums berry.
Did you say bleeding gums cherry?
Bleeding gums berry.
Oh, berry. Jesus Christ. What is it, turning into a hemophiliac?
I got the pneumonia.
No, you don't, my friend. If you had it, you wouldn't be chilling. Unless he had an atypical pneumonia, which is known as a walking pneumonia, usually as a result of one of these bacterias, which are not the normal ones that cause pneumonia.
I got the chickenpox. Yeah.
They used to have chickenpox parties, but they didn't put them on popsicle sticks.
Just pop one in your mouth and you'll be too sick to go to school.
You know what is not a good strategy by Sick Popples, the creators of Sick Popples, is that they chose diseases that actually have decent, like, complication and mortality rates, like that you die. If I had to choose an illness, I wouldn't choose pneumonia, which I can go into sepsis and then develop septic shock and die. I would go for like the common cold. And if I was gonna go for something related to gums, I'd go for like gingivitis or halitosis, not bleeding gums. So I start bleeding out of my orifices.
Lick till you're sick.
Ew. God, could you have made a more disturbing catchphrase? Lick till you're sick!
You have a broken leg and your hand's all smushed and it's all my fault.
It's not your fault.
Yeah, it is. If I'd seen that stupid truck coming, you never would have had to.
Hey, look, his toes stick out of his cast. This little piggy went to market.
It's actually ideal to be able to see the toes, so you could see that you put on the cast too tight. If you start losing circulation, the toes will blanch or otherwise turn white.
Freddie!
Mom?
No, it's Carly. Your mom left. What happened?
I fell.
Are you okay?
Yeah, but I don't think I can get up.
That's why after we have an injury or something even more serious like a stroke, we get these modifiers, safety equipment into a person's home where we actually do a safety evaluation. Someone goes there, we put handrails, seated showers, entry guides into bathtubs. Like there's so many different things we can add on in order to make a bathroom, a living room more accessible and safe for someone who's freshly coming out of a hospital or a rehab center.
Everyone at school is saying you're a hero.
I don't feel like a hero.
Well, you are one. To me.
Something about this is just weird.
Look at your face! And hold it, hold it, hold it.
Oh, that's a broken metatarsal.
I'm sure it's fine. It doesn't really even hurt him.
Whoa. That looks septic, aka infectious.
Hurry, hurry, something's going wrong. Oh, code red, code red.
What's wrong with him?
I don't know.
What's a code red?
Hi. Sorry to keep you all waiting.
That's okay, Doc.
How do his x-rays look? Well, not so good.
X-rays will show us if there's like an osteomyelitis present.
But his foot will require a bit of surgery.
Surgery, probably pins, hardware.
If he wants to have complete mobility of his left foot, we will have to operate.
Well, this is a little strange because it looks like the ER doctor is giving advice on surgical matters, which it really should be the ortho team doing that.
Will you be doing the procedure?
No, we'll get him a foot specialist.
I mean, foot specialist, orthopedist.
Once the foot is strained, the surgeon must carefully and slowly scrape the metatarsal bone.
See, I called that it was a metatarsal.
Woozy!
See, some patients love reading about the procedure they're going for. Some get woozy and do not want to hear about it. That's why I always ask, do you want to know?
My throat. I can't talk.
Most of the time, people think that this is a bacterial thing. Most times when you get laryngitis, like most times, viral.
What's wrong with you?
I think it's his throat.
It's actually his voice box, aka his larynx.
Open! Ew.
This is the worst fake special effect. What? He has a pulsating alien babies where his tonsils are supposed to be.
Your tonsils are awful. Those things are gonna have to come out.
No, we don't really remove tonsils that quickly. Like, if you have many instances of strep throat in a given year, maybe. If you have issues with breathing because of the recurrent strep throats, maybe. but we've drastically decreased the amount of these surgeries that we perform. Are they gonna take out the aliens?
We don't have any anesthesia.
Fine, then lamp. Lamp.
Guys,
What are you gonna do with the lamb?
this is such a...
Oh, that's medical abuse.
Come on, Amanda.
Do it.
Dig in.
Come on, you got it. This is easy. You got something?
You guys, I feel it.
Okay, that's not how we perform tonsillectomies.
Hey, that's a sandwich.
Yeah, he must have had it for lunch. I'll take it.
Ew. Do they know that tonsils are connected to your body? You can't just pull them out like a sandwich?
Feel something, you guys.
I think it's parainfluenza. Is that his heart?
You yanked out his heart.
You can't access the heart through the mouth. I think that goes without saying.
Hey, you guys, I think I feel his tonsils.
But then how did you put the heart back in? This is worse than Surgeon Simulator. When you just throw the heart, you dunk it into the person's open chest. Oh! Ew.
Good job, kid.
My pleasure.
She said my pleasure. Wow, that was terrible.
Hey, Gail! Woo! For a soda!
I feel like I watched this episode.
It's back! It's back! Oh!
Honestly, I wish we could lock up more of the soda these days. So much added sugar. Oh, it contributes to so many problems. Childhood obesity, which yields early heart disease as adults.
Some sicko that put a chain around an orange soda cooler. Kel, Chris is the sicko. What's wrong with you?
Kel, do you know that last month you drank over $100 worth of free orange soda?
Really? I thought it was so much more.
It was plenty! From now on, if you want orange soda, you'll have to pay for it. And until you pay up, the chain stays put.
Oh!
You know what's unfair about guys? Most guys, if they cut out something small, unhealthy out of their diet, like a soda, they start to lose weight very quickly. But I feel like in my female patients, it's harder to just lose that weight from cutting out the soda.
Don't have more soda! I can't live!
Well, no, soda doesn't have withdrawal symptoms like you would have with other very addictive compounds. If you don't have sugar, you'll be okay. Can someone check his pulse, please? And if he's pulseless, please start chest compressions, chest compressions, chest compressions.
Okay, guys?
So, you know, we actually do this in patients who are hypoglycemic. Like if they dose themselves with too much insulin, you can lower your blood sugar so much that you actually need some sugar to help balance that out. Usually we do it in the form of orange juice, but you could use soda, you could use pretty much anything, as long as it has sugar. I have seen in instances where someone was hypoglycemic and someone happened to give them like sugar-free soda, and I was like, no. This is not gonna help the person.
It's flu season at Polk Middle School, so this is a good time to get to know the two different types of sick days.
Oh.
Type 1, when you're really sick.
Which is what those popsicle kids were doing earlier.
101. Influenza in bed. I'm calling your mom.
Well, wait. First of all, how did she diagnose influenza off just checking a temperature? Because pretty much every infection can raise your temperature.
Which means you should probably go home and get some rest.
And you probably shouldn't group kids together so that they all just infect one another.
Honeysucker will totally send you home right away.
Home? I've never missed a day of school in my life. I'll go home and they pride my perfect attendance record from my cold, dead fingers.
If he makes it another 173 days, we'll set a state record.
Anyone that sends their kids to school is doing the wrong thing because you're just infecting every other kid, not to mention every employee that works at the school, teachers included.
Are you healthy? This flu is nasty. Kids are throwing up like crazy.
Some kids do throw up with the flu. There's also the stomach flu, which is really like a gastroenteritis.
I am 2/10 of a degree from being sent home. I need something to keep me germ-free for the rest of the day until 7th period.
Perfect. No germs in there. It's vacuum sealed.
There's no such thing as just fully keeping yourself germ-free. Bacteria live on us, inside of us, and most of it is helpful. There's some times when our immune system gets weakened or we're exposed to some really infectious bacteria or virus that it becomes problematic. But we live in a pretty healthy symbiosis with bacteria in the world around us.
And where am I supposed to sleep?
You pretend to be sick and you can sleep in the infirmary.
Oh, no. No, I heard about Nurse Crutcher.
No, they have a new nurse. Want to see her?
Okay.
There could not be a more fake picture on that old phone. That phone is definitely black and white.
I think I'm coming down with a fever.
Oh, haha.
I'm just glad I have you to take care of me.
Oh, I won't be taking care of you.
Huh? What do you mean?
What's wrong with this one?
He's very sick.
Actually, I feel much better.
Lay down.
No, seriously, I have. Lay down! Jesus Christ!
What school has an infirmary with full medical gear, IV drips? Like, we don't even have that in like legit medical settings sometimes. Why is she icing him?
To bring down your fever.
No. Most kids don't need their fever brought down unless something else is going on. You don't bring a fever down by icing a child because that's way cooling them to the point where it's problematic, not only to their skin, but also to their body temperature. Just take a medicine, an anti-fever medication if you really need to lower the fever. And even if you go into room temperature water, let's say it's like 70, 75 degrees, that water is significantly cooler than your body temperature of 98 or 100 if they have a fever. Putting a child who has a high fever into ice water, you could put that child into shock.
Ow, ow, ow.
What is she doing?
What are you doing?
Feeling your glands.
Okay, but why are you wrestling his glands?
I don't know what's wrong with you. I'm gonna have to take more blood.
What? Where's the doctor?
I think I'm having a heart attack.
I don't think that's it.
I'm not kidding.
What does that mean?
I think what he's trying to say is that he's having a heart attack.
Oh, he's having a heart attack.
Tightness.
Come on.
Shortness of breath.
Oh, this is ridiculous.
Radiating waves of pain.
Those are 3 classic symptoms of a heart attack, but there are some that are less common. Pain radiating to the jaw, to the left arm.
Left arm. Left arm.
We oftentimes have people describe feelings of indigestion when in reality it's just radiating or referred pain from the cardiac region. While there are classic signs of a heart attack, it's important to know that some signs are more subtle. So if you feel like you're having a heart attack, it's definitely time to call 911.
Hey, how you doing, buddy? You need anything?
Why does he have a nasogastric tube right now? I'm really confused. That's a really weird looking nasogastric tube. Maybe this is what they did in the 90s or 80s, whenever this was. That is not how nasogastric tubes look like.
Do you use hot water in the shower?
Yes.
Stop using it.
There's some truth there. If you use hot water too often or for a long period of time, you could actually dry out your skin, dry out your hair. So take a cold shower. It'll wake you up in the morning. I haven't seen nor held a paper chart 7 years. And even when I held it, it was to go into a filing room of old records that were growing cobwebs on them, but cobwebs don't grow. Now, a patient would have to hack into my electronic health record, which is protected by 4 passwords that change every 30 days and must be 20 characters in length, include a capital, lowercase, middle case letter, a number, a special character, a super subspecial character, along with a combination to my high school locker that I can only change each month with my credit card that must be connected to my phone that has Google Authenticator and phone verification on, as long as I have my passport number that I can then call and verify by phone using my voice recognition if I am able to go to the... Okay, I'll stop.
You know, I noticed that someone wrote in my chart that I was difficult in January of '92.
I don't think I've ever written in the chart something like difficult patient. I've definitely had difficult encounters, and if someone was being unprofessional, I definitely documented that. I told you one of my patients started telling me that she's communicating with my dead mother, and that's why she was there to see me, not for a medical condition. That was strange. I've had patients come in requesting controlled substances when they knew that they shouldn't be getting them storming out and getting really mad and cursing at myself and the staff. All that is documented. Outside of how ethically wrong that is, that the doctor is getting a nitrous oxide high before performing a procedure, he touches his nose and mouth, the most transmissible mucous membranes, to the device before applying it to the patient. Oh.
What are you eating? Junior mints. You want one? No. Take one. I don't want. No, they're good. I don't want any. Just take one. No, stop. Kramer, stop it.
We've left all types of surgical devices in patients. Scalpels, pads. I've never heard of a snack, though.
What did they do? They sealed him up with the mint inside. They left the junior mint in him? Yes! Well, I guess it can't hurt him.
I think it could really hurt him because it's not like it's inside his intestine. It's inside his cavity where bacteria are going to feast on it and as a result multiply and cause an infection, causing a peritonitis, which is a surgical emergency or antibiotic emergency. Oh my God.
Oh my God. I'm sorry. I thought this was the baby's room. I'm really sorry.
That's just rude. Medical term for that would be vasoconstriction. In order to preserve body warmth, it redirects blood flow away from non-vital organs and brings it to your vital organs. In fact, your testicles actually come closer to your body because you got to keep your gametes alive, your spermies. The rest of the male genitalia actually shrinks. It vasoconstricts because blood flow to that area when you're really cold and shivering is not of utmost importance. Your kidneys, your liver, your brain, your heart, that's where the blood flow needs to stay and heat needs to be preserved.
Jerry, what brings you here?
I don't know. This?
Looks like hives.
Where do you suppose that could have come from?
Are you suggesting I somehow infected you on purpose?
I want the antidote, pimple popper.
Did he say pimple popper? Shout out Dr. Sandra Lee. How did she infect him? Hives are an allergic reaction caused by an immune overreaction to something usually harmless. So what did she infect him with? Something he's allergic to?
Open your mouth. Open your mouth. Open it. Open it.
Surefire way to get someone to choke.
What kind of pills are these anyway? For Smuckers? May cause panting and loss of fur? These are dog pills.
Please do not take your dog's medication thinking it's gonna work for you. The same goes for the other way around. Like, do not give your dog medicine that you take. Use a species appropriate doctor.
Come on. Come on.
You know, there's actually a condition called hot tub folliculitis where your hair follicles can get an infection, usually with the bacteria Pseudomonas, which tends to live in hot tubs, and it could be a nasty, nasty infection. Don't Google it. Don't Google it.
A little wetter. See, I didn't believe it.
What's with the fake sneezing?
Yeah, we're going down to Mount Sinai Hospital. See, they hire actors to help the students practice diagnoses.
That's true, by the way. We actually have simulated patients where actors are paid to pretend they have medical conditions. We ask them questions. We even do parts of the physical exam on them. There's a special set of actors that we use for prostate and gynecological exams. This is mandatory training because otherwise, if you're uncomfortable being in a room with a patient, how are you supposed to deliver good care?
And are you experiencing any discomfort?
Just a little burning during urination.
Okay. Any other pain?
The haunting memories of lost love.
Why do they have the med students all in there at the same time and the simulated patients in there in the same time and x-rays? There's so much wrong with this scene. What happens is you actually have a set of 10 rooms with 10 different simulated patients and you have the students rotate through each of the rooms. You have a set number of time that you're allowed to be in the room and a set number of time that you spend out of the room writing your note. That's actually part of your board exam, your licensing exam that you take, that you have to show you're capable of taking the practical portion of it, that you're capable of interacting with people.
And so we danced. And I burned for her. Much like the burning during urination that I would experience soon afterwards.
Gonorrhea!
Gonorrhea!
You don't just guess the patient's illness to their face without doing any other questions outside of hearing burning on urination. Why wouldn't he say urinary tract infection? That could be there too. You should ask about discharge, sexual partners, unprotected, protected sex. All those are important questions.
I'm gonna make people feel my gonorrhea.
Faint pulse, very erratic.
What's wrong with him?
Irregular heartbeat, bicarb solution.
He was just looking at me. His
Mike,
eyes...
out of the way, Colonel. Keep quiet for once, will you? Just shut up.
Make it.
No pulse.
Get out of the way.
Chest compression. No. Why are they doing that thumb technique? It's not what's supposed to happen. You're supposed to do chest compressions. And I was gonna say, I'm excited that they put the board behind him because that board actually makes the chest compressions more efficacious than a soft bed.
Anything I can do, sirs?
Yeah, keep him out of here.
Adrenaline, doctor.
Those are the worst chest compressions I've ever seen in my life, over than even what I saw in the D'Amelio TikTok soap opera thing. What were those chest compressions? What is this?
Keep pushing hard.
Dude, what is that? What is, you just like throwing the patient? You have to go deep. Already a very throwback doctor scene here. Their outfits, wow, this is before my time, and I'm getting up there in age.
Want to play a little doctor after we're finished?
That was an inappropriate comment. I've actually been a medical student in the room with a doctor in the past who was a little bit like this. People actually filed complaints and that doctor ended up getting a lot of trouble. You know, I think it was doctors who are older from a different time where that kind of language was acceptable. Those things went unchecked. Now more and more people are speaking up, and I've even been one to speak up and pull doctors aside and say you can't do this or you shouldn't do this. And actually I've had really beneficial conversations from that. So if you see that happening, definitely speak up, both for yourself and for others.
Everything under control?
Yeah, fine. But if you don't move, I'm gonna have to cut around your B cups.
Oh my God, this show is like, I mean, when was this show filmed?
I don't want a Kelly clamp, Lieutenant.
But that's what you asked
Well, give me what I want, not what I asked for.
Give me what I want, not what I asked for. That is the exact opposite of all medical regulations. What you say has to be said back to you, and you have to confirm that it is in fact what you wanted. Because too often you say a medication's name that has a sound alike, and then all of a sudden you're poisoning the patient. Don't give what you thought the person should give.
Another day of bed rest.
Interesting. He checked out the patient for a millisecond, checked the pulse, and said another day of bed rest. Extended bed rest is not useful in many conditions. The more you can get a patient to mobilize with assist, with a physical therapist, on their own, you're decreasing the rates of complications. The way that we've combated this in the hospitals in patients who can't get up and mobilize is by putting either SCDs, which are sequential compression devices that essentially act as airbags and compress your calves to help move that blood along and preventing it from pooling in your legs, or giving a patient anti-clotting medication. You decrease their rates of having a clot, but at the same time, you increase their risk of bleeding.
Oh, yes. It's coming along splendidly.
How about asking the patient how they feel? The patient is not the chart.
What have you got against writing intelligibly?
If I could have done that, I'd have become a lawyer.
Doctors have terrible handwriting. Thank God for electronic medical records. Did I just say thank God for... I take it back. I take it back. I don't want more notes.
Just got this kid out of shock. He's got multiple lacerations. You stick him in the clink, he's liable to kick off.
What is he doing? Massaging his neck with multiple lacerations? What even is this? My guy, what are you doing?
Look, if I hand out AB neg to somebody from the other side and then one of our kids needs it, well, General Hammond will personally give me a taillectomy without a local.
What's a taillectomy? Cutting out a tail?
This is the entire M.A.S.H personnel here and their blood type.
I think it goes without saying that no one just can sleep through a blood transfusion. Based on the principle of patient autonomy, you should not transfuse and steal blood as if it's gas from an abandoned automobile. This is medical assault.
We think you might have hepatitis, Frank.
What are you talking about?
We took a pint of blood out of you last night.
Just think about how many things are wrong with this. They stuck a needle inside of him. They drained him of blood. They also tested him for medical diseases against his will. And now we're saying it openly in front of other people. What is happening here? Where are the rules? Where are the regulations? Court-martial now.
Help me. Help me to clear his throat. It isn't working. Well, maybe there's something stuck down there, Father. His tongue is swollen. It's blocking the passage.
What if he's bleeding internally? Like, I would need to figure out other things. Remember, when you do trauma, you do the airway breathing circulation. You wanna make sure the airway is clear, that there's no objects in there. You wanna make sure the patient can breathe, meaning that they could stimulate a breath. And then you look for circulation to see if they're bleeding out, if they're pulseless, et cetera, et cetera.
He's not breathing. He's not breathing at all. Radar, call the base. Get one of the doctors.
First, you should check for a pulse. If there's no pulse, you should start chest compressions, but let's see.
Is he getting any air at all?
No, sir, not much. Hardly any at all.
Tracheotomy. Father, Radar, listen carefully. You only have a couple of minutes. One of you's gonna have to cut a small hole in the man's throat to let air in.
This is never really gonna happen because forget the part that he's asking them to cut into a man's throat without any knowledge of the anatomy of the throat. He didn't ask so many other important questions. What if this person has such a bad wound that they have a pneumothorax, a collapsed lung? What if this person has been shot in the heart and is bleeding out? You're gonna make this person go through the pain and torture of getting their throat cut with no anesthesia while they're bleeding out internally and gonna die anyway. You need to ask follow-up questions. And the simplest one would have been, does this person have a pulse? Because if the person doesn't have a pulse, you can cut all the holes you want in the neck. It's not gonna help you.
First, you need something to cut with, a sharp knife.
Oh, geez. There's nothing in here but these funny little scissors they gave us in kindergarten. I've got my Tom Mix pocket knife. Tom Mix pocket knife.
Okay, fine, that's fine. Look, you need a small tube. When you make a
straw,
hole, you're gonna put the tube in and the man will breathe through that.
A part of a syringe will do if there's one in the kit.
You could use the top of a fountain pen, just snip off one end.
Is a pencil okay?
No, it has to be something hollow. Think.
Wait. My bottle of eye drops. Eye drops? The dropper is plastic. I'll just pull the cap on.
Okay, that's kind of small, but that'll do. Now look, Father.
I would cut the tip off. Yeah, there you go.
Now take the knife and make an incision, a vertical incision through the skin about 2 inches long.
The reason you want to do it vertically is because there are arteries that run in this area. In fact, the neck is one of the most dangerous places to operate because of all the vital structures that are there. You're thinking about nerves, you're thinking about blood vessels, muscles, glands. When you take out the thyroid, sometimes the parathyroid glands get taken out incidentally as well because they're so small. And as a result, the patient has a dysregulation of their calcium metabolism.
Oh, he did it.
Watching him go like this, it's too big. It's too big, unnecessary. It should be the size of the dropper.
You better get him into OR fast! He's not gonna make it to OR! I think he's got a lacerated aorta.
If you have a lacerated aorta in a battlefield, I can't imagine that you have any chance of survival. Because the aorta is the blood vessel that comes directly off of the left ventricle of the heart that starts supplying the rest of the body with oxygenated fresh blood. And in this case, if you have a ruptured aorta, torn aorta, what have you, you can't supply the body with fresh blood. Therefore, organs start dying.
As soon as I get my hand in there, I'm gonna compress the aorta against the spinal column and try to stop the bleeding. But I think I got it.
This might as well be a comic, because he just has magical healing powers. Aorta, stop bleeding.
We cut off the blood to the spinal cord for more than 20 minutes. He stands a good chance of winding up paralyzed.
He's cutting off the circulation to his entire body if he's cutting off circulation to the aorta.
The Iceman coming. Put it behind me. Let's move this table forward. Get it right up against my legs, right behind my legs. That's all the ice you got?
You know, there is some truth to hypothermia treatments for patients who are going through cardiac arrest specifically, because it decreases the metabolic demand of the cells of the body, so thereby it could potentially decrease the damage that's done when you're having ischemia to that part of the body, meaning not enough oxygen. Just here, this patient's so long gone because of how long he's been without circulation, how much blood has been lost. His blood pressure hasn't been checked once. It's just completely unbelievable. He doesn't even look like he's breathing. And if he's not breathing and no one's pumping air into him, he's going through brain death, cardiac death, kidney death, every organ death.
How you doing, Hawk?
Freezing my phalanges.
I brought the arterial grafts, doctor.
Let me see them. No, these are too small. If too much of the aorta is gone, we're going to be in big trouble.
Well, this one's pretty big.
No, that's no bigger than the piece of spaghettini. We need rigatoni.
Spoken like a true meatball surgeon.
Too much of the aorta is gone, but he's holding it together with his hand.
Did you do the tracheotomy, Colonel?
Yeah, but it won't help. His head injury is much too severe.
Pupils are fixed and dilated.
Blood pressure's up, pulse is coming down.
He's not going to make it.
I'm afraid not.
I'd like to stay with this boy.
What for? There's nothing you can do.
Hawkeye's got a kid in OR who may be missing part of his aorta.
You want to take a graft from him?
Right.
I don't know what the rules with that are. I mean, I know civilians like myself, you would have to do an organ transplant list or perhaps on your license say that you're an organ donor. I don't know what happens with taking a graft from another person. I've never heard that. I need a cardiothoracic surgeon to weigh in on this.
Father, will you tell Hawkeye I may have an aorta for him in 5 or 10 minutes?
I really don't think you can surgically take an aorta from one patient to another. And while it's been under non-sterile conditions, have a person survive. It just, no. I remember when I was a resident, I worked on my surgery rotation as a family medicine doctor. There was one time where the organ transplant team would come in and I would have to pronounce the patient dead, and I have to call the time of death. I was in charge, even though I was a young resident, because the organ transplant team was not from our hospital. So I was staying there listening for the patient's heart sounds, checking their pupils, making sure that the last breath was completely done. And there was a moment where I was gonna say, oh, the patient has passed, and then boom, the pulse had to come back. It was a very difficult moment for me because I didn't know what the right time was to officially make the call of death. Luckily, the surgeons were teaching me at the time, so they were giving me some guidance, but I will say the pressure was on.
Okay, I got it. Great, put on some gloves. Margaret, rinse the graft and heparin.
Right.
Okay, let's sew.
No one checked this poor man's vitals in like 10 minutes, and they're just like cutting off his circulation, no bypass, no nothing. Squirt.
Hack it! Put pressure on it. Suction.
His pressure's going down, doctor.
Pump the blood in faster.
Put the clamp back on.
I don't want to stop the circulation again.
Can you sew it while it's bleeding?
No way, you don't have a visual field when it's bleeding like that, especially when it's pressurized coming from the left ventricle. Each heartbeat, it's pumping like crazy amount of blood.
Okay, you got it.
Okay.
Nifty knitting.
I'm skeptical that this is working out.
Still a few small leaks.
Yeah, I don't think it's anything serious.
No, he's just leaking from his aorta, the main artery in his body. Been without blood for 20 minutes, you know, not breathing. They occasionally give him some oxygen. Bacteria inside his chest cavity flowing throughout his entire body. This is not real, folks. Not real.
Congratulations, partner.
Doctors, he's coming around.
Wow.
George?
Not real.
Can you hear me?
Hello, George.
Uncover his feet.
Got him.
George, wiggle your toes. Hey! Come on!
We don't do that to patients. We do a technique that kind of looks mean. It's called a sternal rub, where you rub really hard the breastbone. That's uncomfortable. I think they're more happy about the fact that they did it rather than this person's actually alive.